Hello there my good people, how are you doing? This is Talanta MKU na kama vile nilikuwa nimekuambia, today I am standing in for Elizabeth Mungai who is not in. So today niko na guest na tunaenda kuongelelea a very informative topic yenye ni kuhusu a rare blood disorder yenye inaitwa Hemophilia. Na nataka nikaribishe guest wangu aji introduce ye mwenyewe and then we dive right into it. Make sure you send the link to any groups, all the groups in Talanta MKU, in Journalism Club, and let's make sure that this discussion helps raise awareness about people who don't know about this disease. So karibu sana, Mr. Pius. I want you to introduce yourself. I don't want to do all the introduction. Kindly introduce yourself. Useme we ni nani, unaitwa aje, what course are you doing in Mount Kenya?
Thank you. Of course, I'm a hemophiliac. Pius Opalakadi here from Equip Pursuing ICT and a hemophilia advocate and a peer counselor. A voice behind Pius Hemophilia Chronicles. Thank you.
Wow. So before to get into the conversation, nataka kujua Pius ni nani outside and aside hemophilia. Pius ni nani? Can you tell me a little bit about yourself? Where do you come from?
From my perspective, Pius is a passionate hemophiliac and a passionate player of rugby. Where from Kitambo, I used to say that people with blood disorders can play any sport, but with management, you can do anything. I grew up from Busia, so I reached out to Mount Kenya to at least unlock that self-infinite possibility and reach out to the at least unknown rare disease patient. Yes.
Wow. So Pius, you know, most people, I am sure most people even in this room do not understand what hemophilia is. When you mention the word hemophilia, maybe in somewhere where people are, I am sure 90% will not understand what hemophilia is. So can you kindly break it down and explain to us in a layman's language what hemophilia is?
Sure, you are true. Knowledge is power. Hemophilia is a rare genetic blood disorder where we lack clotting factors, which are proteins, which aid in the process of clotting. And these proteins are just, we learned them at Form 4 biology. They are called platelets, which aid in clotting process. As you maybe heard yourself, you find out that those clotting proteins come into at least, then they come into at least in a group to bind up the place. So I can say it's a bleeding disorder that where we lack clotting factors. Yeah.
And so when someone looks at you, Pius, you said you're a rugby player, right?
Yes.
And so when someone looks at you, they think that because you have hemophilia, you're not able to do some certain work. Maybe you're not able to work out in the gym. You're not able to participate in activities that require so much energy. How is that experience for you?
My experience from starting playing rugby, before playing rugby, I was playing football. So at that time I was playing football, my father used to tell me that you can't play any sports. But I just had that resilience, that confidence to at least unlock that what is untapped inside me. So I reached out, and when I went to Makui Boys, I found a team that encouraged me to play rugby. With my strength, with my just confidence, I entered to the pitch. I was tackled once. I learned how to hit. When you hit someone, you feel that
feel proud.
Yeah. So from there, I felt that proudness. I felt that resilience.
Yeah.
So I continued. Till now, I can say, with management, with having those clotting factors infused in your veins, you can do anything. Yeah.
And maybe tell us, at what age did you discover that you have hemophilia?
I was diagnosed with hemophilia at age 10.
Wow.
Yeah. Since from them, before then, I had some, let's say, injuries, but my family didn't know about what a rare disease is. That's now when we went to hospital, then we were treated, then we went back. There's a time I had a tooth extraction. That's when now the diagnosis came.
And maybe for us who do not understand that, what is a tooth extraction?
A tooth extraction is whereby you go to a hospital, then you're being prepped, then you go to the room, then the procedure is done, then the removal of the tooth. So before I was prepped, then went to the extraction site. After going there, you find out that you'll see a lot of needles, you'll see a lot of long needles.
Yeah, and at age 10, it's quite a scare. That's such a young age.
Yeah.
So maybe at that particular age, you're still in school.
Yeah.
Maybe are there any challenges that you faced while maybe with the classmates there who did not know that you are hemophilic? How did you handle such situations when they arose?
Can I go back when you say knowledge is power?
Yeah.
That time, people don't know what hemophilia is.
Yeah.
And when you reach out to a person will just say, that's just a curse. Or just, they don't know.
Yeah.
But it's until you reach out. It's until you say that you have a blood disorder, that's when now a person can understand when you self-advocate for yourself. But when you're quiet, they didn't know. Yeah. When I reached out to from that first perspective to that age I was, that time, some of the people isolated me. I had social stigma just because of a rare condition. But with me having that confidence, that resilience, believing that knowledge is power, I reached out to them and I told them, this is not something like a curse. It's a rare disease and it's there and it's genetic. So it's passed down from my mom. It affects mostly men. Then women are carriers. But in these years, #women bleed too.
Yeah.
The von Wimbrand disease, where the women lack the von Wimbrand factor, which aid them in clotting process.
Yeah.
Yes.
So, and maybe how did you said your mom has hemophilia too. Yes. Maybe at what age did you fully realize now that I am hemophilic? Maybe at age 10 you are a little bit too early to understand that I have this disease.
Yes.
So maybe at what age did you realize I am that disorder? How did you take it? How did you process it?
It was hard and it was heartbreaking too. When I was first taken to Moi Teaching and Referral Hospital, that's when now I was diagnosed after the tooth extraction. I went home, then after the tooth extraction, over the night I bled. So I felt at risk. By morning, my father took me to Moi Teaching. There we met a certain doctor from India. There now she told me, you can't play anything, you can't do contact games, you can't just be in an environment where it might cause risk, because when you're cut, it will bleed, but in a longer, yeah. So to me, it heartbreak me. I felt like I'm not in a good environment. And reaching out to my parent, he was a bit tense too. But as time goes by, he explained and reached out to me that this thing is manageable. With knowledge, you can do anything.
Yeah, and I know this is quite a lot to take in. Maybe talk to us about your mental health. I know this is a disorder that not many people have across the world. Yes. But how is your mental health? How are you dealing with the stress that comes with the medication? Maybe being on constant medication. How do you deal with your mental health?
Of course, I'm a lived experience patient. As you have those bleeding episodes, as you meet people with bleeding disorders like sickle cell disease, you find out that your own experience is not even, it's nothing. But when you meet a person with sickle cell disease, you might even cry, because you'll find out that you find out that crisis hit a person. You can't know, but it's until they tell you. So to me, having those bleeding episodes made me mentally strong. And at a certain time, you find out that I had anxiety because of bleeding episodes. I had depression because of bleeding episode. And those led to isolation. Me reaching out to people and the people lacking knowledge, you find out that you are isolated. You have social stigma that comes with you not reaching out to them. So I can say that my mental health that time was a bit, how will I put it?
It was a bit tough.
Yeah, it was a bit tough.
Yeah.
But right now, when now I reached out to Mount Kenya, I unlocked that infinite possibility. Where now I joined a peer counselors club.
Yeah. Wow.
That's now time I felt like we need change in Kenya. We need change that the government not giving us. We must create that change so that that change is felt out there. Without action, without actionating, you can't do anything.
Yeah, sure.
But as too, as those Gen Zs, as living experienced patient, what are you doing at the moment? What small steps are you taking to improve your mental health?
Yeah.
What steps are you taking to even improve those around you? It only calls for every one of us to create change. Don't just be there to say this and this and this. Create change, be self-aware. You'll find out that you have a lot untapped, brain-wise and health-wise. It's until you unlock that untapped decisions to make. When you make it, you'll unlock that self-infinite possibility.
Wow. So you said you joined a peer counseling group where they helped you through the depression process, and maybe I would want to know, in that group, did you find others who have your that kind of disorder?
No, I didn't find, but I reached out to the chair lady of peer counseling club.
Yeah.
Our cohort. You find out that her too, she had some trouble behind. I don't want to mention some.
Yeah, sure.
So I felt like I'm in an environment where we all have these challenges. It's not something like a disease, but once you accept that you can do it, that's first step to at least acknowledging that you can do anything.
Yeah, sure.
But when you're quiet, it will eat you up.
Sure, it's about the mindset, how you set your mindset. And okay, something that most people do not know out there, that it is perfectly, it's okay to not be okay.
Yeah.
People think that when you have these disorders, that life is not going to go on. So I'd like to ask you, your friends and the people you interact with on a daily basis, how do they know that you are hemophilic? Do they understand what you're going through? And maybe have you shared with them to inform them about your condition?
Yes, of course, I'm hemophiliac. My lived experience patient, those bleeding episodes, those anxiety of being socially isolated, led me to creating a voice through Pius Hemophilia Chronicles. That's where now I create awareness. That's where now I advocate for myself. If I meet you, I'll tell you something about hemophilia. But if you're not bringing value to me, those energies are not. So I usually say, keep yourself in a gene environment. If your gene ain't, let me break a little bit. If your gene ain't gening with the other, you're not in good environment. If the other person is not reciprocating the energy,
it should be two-way. It should be two-way.
Yeah. That's toxin. It's until I tell you something, then you challenge me. Have you ever tried this? If you learn something from me,
sure.
and you'll keep on. But if I can tell you something, then you diminish me. Well, what's that? That's a toxic.
So you've mentioned about Hemophilic Chronicles. Maybe expound more on that. What is that?
Hemophilic Chronicles is a personal brand, and it's a non-profit company or organization where I reach out to the unknown, diagnosed patient. People out there don't know what they're living with. People out there, they're not diagnosed, But it's until you diagnose someone, it's until you have those symptoms, it's until you have easy breathing, prolonged bleeding, that's when now you might go to the hospital. The case of me, I went to tooth extraction, that's when now I had those prolonged bleeding. I went to my teaching and referral hospital, that's when now I was diagnosed. My blood was taken, some samples, then after then, I was told that I have a blood disorder. Yeah.
So maybe this Hemophilic Chronicles, do you have any social media accounts, or you just do it in kawaida too?
I reach out through all social media platforms, through Pius Hemophilia Chronicles, and I can say that if you can't create change using this technology right now, you'll still say that there's no support. But it's until you take that step to do it.
Yeah, sure.
Platforms are there, but how many of us are using those platforms just to, you wake up and just scroll?
Yeah.
You're not waking up to at least think, I can do this, and on this platform.
Yeah.
You know?
Yeah. And still on Hemophilic Chronicles, I'm sure the response has been great. You've gotten people with the same kind of disorder. So maybe have you gotten with a particular person who has been has given up on fighting this disorder, has maybe lost hope on hemophilic disorder? Maybe have you come across someone who was in that condition, and you helped them? You helped them through.
Yes. I've come up with a couple of people. There's a time we went for international conference at Kisumu. It was sickle cell disease and hemophilia conference. There I met different people with different perspectives. Those people, you find out that before sleep, they had to at least ganja themselves. But you know that thing, brain-wise, your brain might shrink, you know? Your receptors might even go. Neurons
Have you
might.
yourself come to a point when you decided you're going to ganja yourself, maybe to not to not live through the moment? Have you come to such a point?
I can say that it's until you do something, that's now when time you will do, you know this thing is good for you or not.
Yeah, sure.
So as for me, I saw someone do it. And I said, I can't try it. Because of what? Knowledge is power.
Yeah, sure.
If you see someone has done it and you want to do it, your experience might be different. If I can use it, what benefit is it bringing to me?
Yeah, sure.
Yeah.
And so coming to MKU, I am sure in Mount Kenya University, there are also people who are with the same disorders. Maybe do you have some kind of formation or organization that you have come together to help yourselves push through this?
You'll excuse me on this phrase. Of course, I'm a hemophiliac.
Yeah.
I use Pius Hemophilia Chronicles to reach out to the unknown blood disorder patient. It's until I stepped my foot at Mount Kenya University and I found out that 1 in 5,000 males in Kenya are not diagnosed. Just imagine the whole of Kenya now, 5,000. Only around 460 only. The other, where are them? Or where are they? So in Mount Kenya, I found a hemophiliac too, who suffers from hemophilia A, that where we lack factor 8. I reached out to him. He's pursuing petroleum, and he's doing something. He motivated me, and right now I can say that.
And maybe to cut you short, is there hemophilia A and hemophilia B?
Yes. Okay, it's basically 2 types. Hemophilia A, where we lack factor 8, and hemophilia B, where we lack factor 9. And in those hemophilia A and B, there are types. Yeah, there are severe, moderate, and mild. Me, I have hemophilia B severe. Yeah,
Okay, I'm so sorry for that, but
no worry.
let me bring you back a bit. When it comes to signs and symptoms of hemophilia, apart from excessive bleeding, do you maybe have other signs and symptoms that occur apart from bleeding excessively?
Yes, there are quite some symptoms when you find out that you can have prolonged bleeding, you can have easy bruising, find out that you have an bruise, but it's not the natural bruise. Prolonged bleeding, you might have a bleed, but it's not ending.
And
It's
maybe how
just-
long does it take for it to stop bleeding?
It's until you die.
Until you die.
Maybe now,
so
when
maybe
you-
if I cut you right now, how
Yeah.
long will it take to stop the bleeding?
Okay, how long will it take to stop the bleeding determines when now you're infused with factors or clotting factor replacement therapy.
Yeah, sure.
Those are how will I put it?
Just in your words.
Okay, those are like platelets which are made in the lab. Now you find out that you are put in the bloodstream to at least aid you in that clotting process. Yeah.
And you said you're a rugby player,
Yeah.
and maybe have there been instances where you got injured or bruised while playing rugby?
Yes.
Because I'm sure rugby is such a strong game. You have to rub shoulders with people.
Sure.
Maybe have you gotten bruised when you're playing rugby?
You have gotten a lot of bruises on my hips. Hips are
Thighs.
Thighs. Yeah, thighs. On my thighs, you find out that when you go to a person, the person won't know you're having a blood disorder.
Yeah, sure.
So you just hit each other well, and the respect comes out of there. So from it was Form 2. I was hit at my thighs, my thighs, and that's when I learned that with knowledge you can learn to quit, and with still knowledge you can learn to stay.
Stay and push through.
Yeah, and find out maybe you having a lot of experiences to expound on. But I continued. I played rugby, and I can say God. It's only God.
It's
that
only
knows.
God.
Yeah.
So maybe do you play rugby here in MKU?
I hung up my boots
Uh-huh.
because there's a time at Form 3 I was hit very well. I took almost 3 months at home. After being hit, I went to usually have a technique which is called PRICE. Protection, R for rest, then I for ice, then C for compression, then E for elevation. So after you being hit, P stands for protection. Protect yourself from that environment. R means for rest. Remove yourself from that scene. Go. That's when now I went for rest. But through that rest, my leg became huge. After just 20 minutes, you can imagine when now you are hit in a sensitive part like elbows, like head, you know. So after that rest, I went for ice. I usually have some smaller ice, but you wrap it so that you put at the place where you are hurt. But when you put it directly, it will damage your blood vessels. Now then, I went for compression. Don't press the place hardly, but just press it. Just not in a usitumie nguvu mingi. Yeah.
So maybe just to ask you,
Yes.
let's talk about the medication process. With such a disorder, you have to constantly be on medication. Maybe explain us, maybe talk to us about how the medication process is. How regularly do you take your meds, maybe?
I must say that I need to take care of myself so that I don't end up having deformities, having joint damage due to you're not being careful. It's until you take care of yourself, that's when now everything will come at a natural way. So on the part of medication, when I was first introduced to Moi Teaching Referral Hospital, I was described for clotting factor replacement therapy. You're being infused and determines with the how the damage is. If I'm damaged at my thigh, if I'm damaged at my thigh, and if it's huge, I might be given a lot of doses or quite a big dose, and it might take, let's say, 3,000 units. But when it's just a minor, you can just take 1,000 or 1,500. Per vial is 80,000 Kenyan shillings. Just imagine if you are damaged that hard and you need 4 vials. That's quite a lot of money.
Yeah, sure.
Yeah.
And maybe I can imagine those are huge amounts.
Yeah.
And maybe for you personally, how has the financial journey through the medication process been? Because I know these are hefty amounts when it comes to the cost of living nowadays. 80,000 is not some cheap money. Yeah. How has been the financial journey?
First, big up to Anthony Asimugo Palakadi from Busia, my parent. I must say thank you for him for sacrificing a lot that I'm working hard to at least say he will enjoy life the way I want him to enjoy. He sacrificed.
To give back to him.
Yeah, he sacrificed a lot. The medication is in form of donor. We get donations from Novodosky, foundations from outside, through Kenya Hemophilia Association. You find out that through Kenya Hemophilia Association, they link up, then we get a donation. Since sickle cell disease, since hemophilia, mostly it's around the western and parts of sub-Saharan.
Yeah, sure.
Yes.
And maybe just to ask, has there been a time when these government entities do not give you donations, a time when you do not have these donations? How do you survive through that?
There's another type of treatment which is called tranexamic acid. You'll have to, they are in form of tablets. You take them, but it heals slowly, not like
not like the other ones.
Yeah, clotting factor we just infused, and it's just soft. But the tranexamic acid, not all people can want to take it.
Yeah.
Because of you'll heal slowly. You'll take time before getting to at least that time that you can say you're good. Government is there. But I can say, government hear our cries out. Even if we are the one trying it, or we are the one living with a blood disorder. Just imagine your child has a blood disorder. What can you do for the child? What cautions can you take to at least say, we need an environment that favors us all, not an environment that uses us in order for them to feel they're in a good position. I cry out to Kenya Hemophilia Association. When the medication is there, take that initiative to at least reimburse those treatments, so that when you go to a treatment center, you find out the medication. When you go to a treatment center, you are treated well. Factor is there, but when you go to hospital, you might be said, or you will be told, the medication for that specific area will need a little amount. But when you give a certain amount that will heal the process well, it will not lead to deformities. I cry out to the government, intervene and help us get this donation, help us to at least create our own or build our own support network, build our own support system to at least produce those clotting factors. Yes.
And maybe to ask, are these drugs accessible in public hospitals? Because, a lot of public hospitals do not have medications that handle such disorders. For you personally, has the medication been easily accessible to you?
As for me, I can say thank you to my farm, or to my father. When I had a bleed, he reached out, to that Moi Teaching and Referral Hospital. Because of what? He had that kali pia, kupush for what is best for his son.
Yeah, sure.
But it's until parents too. Don't just say government need to do this. Do it. Show them that your son deserves something.
Show them it's possible.
Yeah. The government needs someone to push. But when you don't push, you'll be just seen like you're just there. Yeah. So on that part of me reaching out to the government, the medication is not for sale. It's donor-based. If you don't get that factor in a donor perspective, you won't get any medication. And if you want to purchase, be ready to get some 80,000. Be ready to get that 120,000. Be ready to get that for the new treatment, 2.1 million. How will you get it? And you're just
there come
local.
a time where you are in such a situation?
I've been in a situation that can say the tranexamic acid helped me solve a certain huge, it was a joint damage. I played, and after some time, I took the tranexamic acid, and it helped me. So I can say, if you take care of your body, if you eat well, if you have the nutrients, your body can, the food can aid you to heal the bleeding episodes by 40%. So if you eat well, if you know what you eat, the kind of nutrients, it will help the blood to at least push to heal you.
Yeah. And maybe back to your family, are you the only sibling, or do you have other siblings who have hemophilia?
I'm the only sibling who has hemophilia. When I was diagnosed, I was passed through by my mom, since they are the ones who carry that gene, which has hemophilia. So after being given the gene X, then my father produced Y. You find out that the other family members might be afraid to go test, but it's until I now self-advocated. It's until I pushed. That's when now they went for checking up. So I'm the only one who has a blood disorder in my family, but in my mom's family, my cousin had it. So from their family tree, I can say that there is a gene alteration around there. Yeah.
And maybe for your parents, was it a difficult process to deal with hemophilia themselves, as compared to your situation? Has there been any differences? Maybe their time was a bit difficult compared to you now.
In my perspective, when I had hemophilia, that time reached in a place that I didn't knew what happened to them. I was born in a time that God took, or let me say it's natural, he took my mama that time when, that time when I was diagnosed, that time when I was still a little boy. Imagine still lactating, still around 7 years. So it was a bit challenging. For them, I didn't know if they diagnosed themselves and knew. But as for me, I can say it was a breaking news to them. They didn't know what hemophilia is. So me appearing, it brought now.
They had to adjust.
Yeah, it's
And
there.
maybe for your father, because you're telling us he has been with you throughout the journey from where you are diagnosed, maybe how has this been for him? I know for a parent, the only parent, it's a bit difficult for the father to handle you in such situations. How has been the journey been for your father?
Of course, I'm a hemophiliac. As a lived experience patient, you have to explore, you have to experience the environment you are living in. So being raised by a father, I can say that you know how fathers are.
Yeah, sure.
Anakwambia kitu, next tukikataa, lala chini kiboko.
Na maybe wewe hakuwa na kunini because you have that disorder.
No.
Alikuwa anasema hata ukikosea I'll not
Kwanza I used to say, go for your cane. I'm not getting that cane. Go for your cane. Because you know what you've done. So you just go for that cane. And it's not a small cane. It's something that when you're hit with, you can say,
so it was discipline over your
it disciplined me.
yeah.
That's why now I can say I'm in a good road. Because of him, I can thank God that he stuck by me at any position, at any environment. I remember there's a time we went to my teaching where I had
The thighs.
the
injury.
thighs. When I was hit in rugby,
Yeah.
I went to hospital. Then I was laid to bed. But you find out that my father had that resilience in himself. He believed in me, but I believe in God too, and him. He gave me that motivation to have a prayer and lean on myself to understand that my body can do it. So I embraced. While embracing, my mind switched into something that I was just thinking a lot, thinking around, and exploring ways to at least bring change, so that when I'll be, maybe hypothetically speaking, when I'll be in hospital, he'll be even just in a warm place.
He'll be comfortable.
Yeah. But when I was sleeping, he was sitting at the chair. So I was like, I'm in warmth, then my father is sitting in cold. Now you can imagine the coldness in Eldoret.
Yeah, sure.
It's a bit cold. So now I started embracing myself. I started acknowledging that, Pius, you have to at least leave some things. You have to leave rugby. You have to think of ways that can empower the other undiagnosed people, empower the lived experience patient. That's when now I started the Pius Hemophilia Chronicles. There I record my bleeding episodes. When you find out that when I have a bleeding episode, I tell them, don't try this and this and this. Just leave.
You post on all socials.
Yeah. Just do something that will not lead to you injuring yourself. Your parent goes through a lot, but they don't tell you.
Yeah.
If you get something here in campus, if you get something there outside, even if in your family you have something, use it well and think that they are human beings too. If you get it, plan it.
Yeah, sure.
Not just go outside there. Uko na ngapi hapo? Niko na chwani. Nitaongeza chwani. Utachukua nini? Kibangi. Utaongeza chwani. Utachukua nini? Tei. What's that? And that money, where is it coming from?
Yeah.
It's until utoke shule, ulizo yo pesa. Nitumie hata 100k.
Yeah.
Utatoa wapi?
Imagine.
And you're in a big institution.
Yeah.
Where will you get it? You have to take care of yourself. You have to take care of what your parent gives you, so that you even enrich your body. When you go outside, you're competent enough to unlock that, continue empowering lives out there. Don't enjoy life. Just live an experienced life.
Wow.
Yeah.
So you said taking care of yourself is key.
Yeah.
And maybe still on family, your extended family, your uncles, maybe your aunties, how have your relationship been with them when it comes to this disorder? Are they supportive enough? Do they offer the necessary support to you?
I can say that living with a blood disorder is expensive. So the people around you, they don't know what you go through. Through social isolation, through you, they learn a lot. But when you're not expoundful of what you want, when you reach out to them, they don't know about a blood disorder. Some of them might brush you off. Some of them might not know how to live with a blood disorder takes. It's until you tell them that it's not easy. But some of them, we are in an environment that it can't favor us all. But with them knowing that we can do it, they learn that we can do it. But for them, they don't understand. It's until I explain myself. It's until my father reaches out to them that this is just a normal person. He lacks just that clotting protein, which is platelets, only. The other things you can explore. But there's discrimination because you are expensive because of that blood disorder. So they fear because I have something that when you're hurt, you need that 100,000, you need that 80,000. Yeah. So reaching out to them helps me at least be in an environment that I can advocate for myself. I can say that with or without family, you can build yourself. With or without family, if you unlock that infinite possibility around you, you can do anything. As long as you put that mindset, as you said, as long as you plan yourself. You can't go to success without taking steps. Even a successful person can tell you, I have a story. Nilianzia hapa chini kuamka hii time na hii time. So, I can say that me reaching out to them, me creating knowledge, me telling them that it's just something small that I lack, brings hope to me, and tells them you need to learn something about a blood disorder. Yes.
Yeah, you've said mindset is key.
Yes.
That is very right. Mindset is key. And before we go on a short commercial break, you've talked about Hemophilia Chronicles. So we want to play something small on the screen there from your TikTok account, and then you'll explain to us how you explain to us what it is.
Okay.
Okay. Actually, it's a picture, so you will tell us more about that picture.
All right.
No, I won't live in fear. There's a greater reason I'm here. I want life to live, but that's when me I go hard. Yeah. Tomorrow no promise, so me no time on me yard. Man live without limit. Man in it to win it. Live without limit. Yeah. You see this in the return and the future.
Okay, so you've seen the picture. So kindly briefly tell us about those pictures. The story behind those pictures. I've seen you are on KBC.
Yes. Mm-hmm. I can say, let me start from the music. Live without limits. Where you are at right now, believe in yourself, you can do it. I started from that one video, saying that I'm a hemophiliac, and I can do it. I can change a life out there. It was last year. I reached out, and someone marked me on Kenya Hemophilia Association and said, this is a voice. He's doing something. They placed me at KBC to at least shine a light on how to manage hemophilia. With mindset, you can unlock how to manage those bleeding episodes. You can unlock how to, on part of sickle cell disease, those crises, what can you do to manage them? So from the picture, I can say that with management, you can do anything. Have a life that has no limits. be an environment that you don't put yourself in a victim mode. You just have a personality that wants to create change and explore what you have within. Don't seek environment that is outside. Will attract what you want when you reach out. You'll attract what you want once you actionate. Without action, you can't do anything. But with action, you'll attract what you want. Yes.
Wow, that's such an inspiring story. I'll have to applaud you for being a voice to those people who have such kind of a disorder.
Thank you.
Yeah. So, guys, we are taking a short commercial break. We'll be back. Mr. Addison is coming up next with the entertainment segment. We still, I'm being informed by my director, we are still in the first segment. So, let's go on. You said you are a rugby player, and maybe you okay, let's get to that commercial break. Welcome back, good people. Today we are talking about hemophilia, and I'm in studio with a guest, Pius. And before we went to the break, we were talking about rugby. I'd like to ask you, maybe do you consider going back to playing rugby some point?
Yes, I might consider going for playing rugby again, but I hung boots because of I was hit. But right now, I can say, with what I'm working on as a personal brand, with what I'm working on right now, it might sponsor it next. So reaching out and creating that personal brand will aid me in playing rugby on next maybe a few years. It's until I have that clotting factor replacement therapy. Once you have that, you can infuse yourself, then go play rugby.
And so far, currently, what is maybe impeding you from getting that infusement?
Before getting an infuse, you have to injure yourself. And maybe it might not come right, but when you get an accident, that's when now you go to hospital.
Yeah.
But when I take care of myself, you won't go to hospital visits much time.
Yeah.
But when you can't be given a medication that's in a donor based, just freely just go utilize.
Yeah.
It's until you have a bleed, it's until you injure yourself. That's when now you go to hospital, and you'll be diagnosed, and maybe doctor will go through you and tell you that you need some units, and you'll be infused. That's when now you'll be given factor. Yes.
So let's say right now you have already been infused. Is it safe now, completely safe for you to go back to playing rugby? Ama you'll have to kungojea for some time for you to heal completely?
You'll have to wait. When you've injured yourself, you have to wait that place to heal, because you can't use that. If it's a joint, you can't use it, because when you use it, it will lead to blood. Remember, you are clotting internally. So when those clotting go to that specific place to aid in function of platelets, aid in unclotting the place so that it becomes, you heal naturally. But when you want to go play, you just infuse yourself and you go play, because it's just inside. And when you're hurt, it takes 12 hours in the body. So after 12 hours, you'll have to at least infuse again another vial, so that it aids, it fastens that healing process. But when you're just normal, you can't waste, because remember, it's expensive. Yes.
And maybe in that rugby space, do you feel like the coaches maybe when they are aware of these disorders, maybe for your case, when you go to play rugby and those you're playing with understand that you are hemophilic, maybe the game will be a bit different, they will be lenient on you perhaps. Do you think it's possible when it comes to rugby?
It's until you talk to your playmates. The people you play with, they know how you play, they know how the power you got, they know that tactic that you have. So you'll have to at least reach out to them. You have to reach out to that coach. I remember in Form 2, I reached out to my coach, and I told him I have a blood disorder. That's when now he taught me how to at least learned to kukwepa some tackles, and I'm great at running. So I used to be a winger. A winger is that person when you're given the ball, you have to step, you have to at least dodge some people so that you reach out to a place that you want the ball to be placed. So I reached out to my coach, and he told the other crew, this person has this and this and this. When he's tackled, he can even end up dying at the moment. So it led to them learning that when a person comes, they aid me in giving me space, so that some of them, I had to learn through training to how to tackle, how to sit down a person, how to hit them, how to at least to dodge them, to at least reach to a place that I can say I'm safe. I've done a try. So it determines with how you relate with the opponents and how you relate with the playmates. Yeah.
So apart from that, are there any other games or sporting activities that you engage in?
I engaged in chess, but now chess, I felt now I need to practice a little bit. Yeah.
But at least that's a less impactful game. You cannot get injured when playing chess.
Chess, swimming, brisk walking,
Yeah.
cycling. Those are the things that is recommended for rugby. For now, the blood disorder patients.
Yeah.
It's not recommended to go for sports that will damage you first. You'll have to go for sports that will aid you in, you just calm. It's not leading to spontaneous bleeds. It's not leading to things that will take your life very fast. So I can say swimming. I love swimming. I love journaling. I love brisk walking. I love exercising. That's very paramount. You have to exercise so that you release some toxins out of you. You have to exercise so that your body even grows naturally. Not you're just there, you're just eating. You have fats, you have a lot of...
You have to keep fit.
Yeah, you have to keep fit. Yeah.
So coming to Mount Kenya University, we have something or a program called psychoeducation. I'm sure you are familiar with that.
Yes.
So we are going to play that video on that screen, and then you'll talk to us about that.
All right.
Be different from the other person. That's why you need to sit down with either a psychiatrist like me or psychologist, and we can talk over whatever issue that you're going through. But I will say that weed, alcohol, whatever it is, alcoholism, or maybe going into dangerous behaviors to now manage your anxiety. Thank you.
Well, I think looking for help is really important. Instead of keeping it to yourself and bring up an issue, so we encourage you to see your counselor, and then you'll refer you to daktari, or now you know you have to wellness, you can have the details and you can take yourself there. The coping mechanism you take is very, it can be very destructive. Instead of showing
Wow. So I'm sure you're familiar with psychoeducation, right?
Yes.
So maybe talk to us about that. Were you a cohort sometime?
Yes, I'm in the new cohort, cohort 10, where I was introduced, I was empowered. I felt insightful. I felt motivated to still on the journey of self-awareness, on the journey of knowing that your cognitive reserves have to at least be expounded, how to at least learn more about the brain power, learn more about how that flow, that psychic energy needs to at least be expounded, be learned on about. Me joining psychoeducation, I felt that in Mount Kenya University, you have a lot of opportunities. And a lot of those opportunities are being chased when you are gearing on, maybe you're finishing up. Why should we start these opportunities once you see it at that first time you join? Mount Kenya University is offering a lot of opportunities. There's Talanta MKU show. How many have reached out to at least show what Talanta MKU can do for them. So I saw a gap in my life. What can psychoeducation do to me? Mentally, psychologically, socially, health-wise. I learned that it can bring me at ease. You learning more things will challenge your mind. You learning more things will challenge your neurons. Your neurons will start developing new branches. But when you're just silent or dormant, those neurons are just cut off and they become waste. But it's until you become self-aware, it's until you take that step. I learned that, and I put it as a rule in my life. I'll be ready to be taken a fool as long as I create change in my life. Be ready to be taken as a fool, because a lot of people are fools. A lot of people don't know what they are doing. But it's until you have that psychic energy, that flow of energy, you are in a safe environment, you are safe in your own self. It's until you be safe in your own self so that you'll accommodate others. It's until you learn something new so that your brain power increases. Remember, Kenyans, it's shown that we have a high IQ, but most of us have not even expounded even a little bit. Most of us are just there in the streets. Most of us are just there in MKU. Nimekuja MKU, nimetulia. Niko campus, such an enjoy. It's here where now you'll create change, and it's here your life will end like ashes.
So would you advise other students in MKU to join the psychoeducation program?
You must self-advocate for yourself. What you want, those opportunities that you want are there. Gaps are there in your life. But it's until you take that opportunity to say, I want this and I can take it. It's until you take an action, that's when now change will come to you. It's until I took that action to go for psychoeducation, that's when now I can say, I went for psychoeducation. That's when now I can say, I can sit with someone and listen, and learn what the person has. We need to understand the personality that we have. We need to be self-aware. We need to understand that the person that you bring close to you will give you a good energy or a bad energy. It's until a person gives you or challenges you, that's when now you feel you have something that is in you that's worth. But when someone is just around you and is entertaining you like a movie, how are you even benefiting?
Wow, perfect. So you've talked about Talanta MKU,
Yes.
the program which you are in right now,
Yes.
and is a platform for people like you to share their message and inspire others.
Yes.
How would you rate these? And actually it's all these people who are in this production are students of MKU and of journalism. So how would you rate this program?
Empowering. I feel motivated. I feel insightful. But through self-awareness, we can go far. So whatever us of us are doing out here in Talanta MKU, in Mount Kenya University, specifically Talanta MKU, you are doing a good job. Your Rising Tide Media presents something big, something that other universities don't have. In Mount Kenya University, you have something unique, and we can unlock that self-infinite possibility. This club has that self-infinite possibility, but it's until every one of us take that opportunity to stand groundly and say, I can do this in this Talanta MKU club. Sure, I can do this in this Talanta MKU. Sure, but you're not there to just say, I'm in Talanta MKU. Sure, what are you doing to elevate that place? I once collaborated with Anne Christ, that person that said, I have hemophilia. It's Dr. Anne Christ, and big up to her. He is helping Kenyans and he's helping Africans and globally. I can say that it's until you meet someone that know the worth of time, that's now when you'll know how to explore the opportunities that you have, explore that inner untapped opportunity or self-infinite that you have. So, Talanta, you're doing very good. You are empowering to others. You're insightful to others. You're working in a good environment. You're even exploring what is not there. So continue. And I can say, big up. God will bless.
Yeah.
Small steps lead to bigger opportunities. It starts small, and you'll end up being the best in all the universities. But with self-awareness, with everyone taking change, with everyone creating that change that we need. That's when now action will breed change. Yes.
Wow, such powerful insights from you. So time is running short, but before we go, I'd like you to tell me what is your dream? What are you dreaming about? What are you hoping to achieve in life? And what's that one thing that motivates you and keeps you going every day?
In my perspective, I dream to see all rare blood disorders patients being taken as not from expensive, but just we are all in an environment that we need to learn from each other. But it's until we create change, it's until every one of us starts to have that ikigai, have that purpose, to at least do something so that that change comes to us. But I dream to see the undiagnosed patient learn more about themselves, learn the type of blood disorder that you have, so that you don't have deformities. You can see, I'm full, and I played rugby. Rugby is a game that when you're hit, having a blood disorder, you can just die. But through self-awareness, through me knowing that this is my strength, this is my weakness, it gave me an opportunity to at least say, in the near future, I want those that work hard in Talanta MKU, I give them something, because there's a certain time they gave me something.
Yeah.
So I would want to give back to the community, to where I started from. Those that work hard right now, promise I can do something for them.
Yeah.
But if you don't work hard, you just want to be there like a picture.
Yeah.
You're not doing anything.
Yeah.
Unlock that.
Yeah.
Even if you die, God will say, at least he did something.
Yeah.
Not like a baby. God who feels vibaya, by the way. God asikiangi vizuri, umedede na utujafanya kitu yote kwa earth. So learn to take opportunities in Mount Kenya. Learn to do anything that will propel you in the future.
Yeah.
Be ready to be taken a fool.
Yeah.
As long as you create change in your life.
Yeah.
When you create change in your life, you'll unlock doors.
Yeah.
But when you don't create change, how will you expect opportunities to come?
Wow.
Yes.
Yeah. So those are such inspiring words from you. And as we finish, one message to the people who are living with hemophilia and they do not believe that they can do it. Inspire someone, motivate someone through your story.
Of course, I'm a hemophiliac. A lived experience patient. You can do it, and I can do it. It's until you do it. That's now time. I know I'll continue doing it, and I'll continue impacting. Whether you're curious, whether you're a healthcare provider, whether you are a caregiver, whether you're just a lived experience patient, what are you doing in your life to create change? What are you doing in your community so that knowledge be there in your community, so that even that person that who doesn't know what living with a blood disorder means will unlock that self-infinite possibility. A word of encouragement. You are not alone. Talanta MKU can bring change. What are you doing outside there that can bring change? Take that opportunity of where you are right now. You are your own doctor.
Yeah.
You know where there is change,
Yeah.
and you know where you can create change.
Exactly.
Yeah.
Wow. That is quite an empowering discussion from you, Mr. Pius. So we've come to the end of this session. Thank you so much for your time, Pius. It's been such an informative, educative, inspiring session with Mr. Pius, talking about people who are living with hemophilic disorders. From me to you, my name is Munene John. Mr. Addison is coming up next now with some entertainment. Till next time, bye-bye.
Can I say something? So, Shujas, reach out to Pius Hemophilia Chronicles to learn more about a blood disorder. Stay beastly, stay fearless, and stay empowered. Hemoshuja loves you. Love yourself and unlock that self-infinite possibility. Peace.
Thank you so much, Mr. Pius. Keep watching Talanta MKU. I'm Munene John.